Actually, really, I was so surprised because I was waiting this kind of projects before earlier days, because it has to be. This is really chronic disease, and there is no much attention recently. If you compare with the old days, we can say more attention, but it's not enough. We need more attention during my country and during the whole Europe and during the world. That's why we need more attention, more things to do. And this is really, I don't know the background, but I believe this is one of the important projects about this subject. So far, there was no this kind of whole project. Most of the projects are related to the research or for the therapy. But this time, as I understand from your project, the first aim for the increase of awareness, and the other one is the early diagnosis, if I understand correctly. That's why this is really good for us. In my view, the more important thing is the diagnosis now for the endometriosis. I would like to highlight the diagnosis. First diagnosis, after that research and the therapy and other ones and the long-term profile. But the short term, we need more diagnosis. We don't know the exact incidence of the disease in the world, in my country, in Europe. That's the main problem. And we say the 7 to 10% in general population. I mean the 5 to 10% general population. That means huge number, but I believe just roughly, we know that only 20 to 25% of the patients, not the other ones, they are undiagnosed now. That's the main problem. That's why we have late diagnosis. Meantime, in different society is different, but main time around 6 years and to 7, 8 years. That means the first sign of the symptoms to diagnose of doctor, yes, she is the endometriosis. It's really long time for the patient, for the patient's destiny. That's why I would like to most highlight the diagnosis. That means not the surgical diagnosis, that means the non-invasive diagnosis, which is very, very important in my view. But unfortunately, so far, there is no good, reliable non-invasive diagnosis for this patient as far as I know. Sorry about that. For diagnosis, related diagnosis, we need more awareness. I mean, for the school, for the high school, and for the university. That's very important. They have to know this sign maybe is a sign of the endometriosis. This symptom is a sign of the endometriosis. They have to know. They are not any information about this one. What is the dysmenorrhea? What is dyspareunia? What is the other signs of the endometriosis? They didn't even know the name of the disease. It is really difficult. They say the chocolate cyst. Unfortunately, some of the doctors, some of the healthcare personnel even say is the correct pronunciation endometriosis. This is another problem in my view. That's why we have to teach them. Like I will compare with the Alzheimer disease. Alzheimer disease, they know and they say the correctly. This is not the easy pronunciation, but the endometriosis, I don't know. They are not saying very well. That's the other problem. That's why we have to teach the people how can say this disease or what is the main symptoms. We have to think, maybe I have endometriosis, I have to go to the doctor. I am involved in this disease last nearly more than 25 years. 1995. I don't know how it was your age, but in 1995, I was at Yale Research Laboratory about endometriosis. From that time to now, I was dealing with research and I was dealing with the therapy, I was dealing with the clinic, I was dealing with the, I established the Turkish Society in year 2009. After that, I involved the European Endometriosis League. I was the past president so far, something like that. That's why I would like to involve this project at the beginning of this one. Did you understand what I mean? Because really, I gave a lot of time for this project. I just learned from this one. You choose one of the official companies in Turkey, European studies, something like that. I don't know the exact. I didn't remember exact name of the. This is just a political company. Political means European standards politics. That's it. They don't know even the endometriosis. They investigated who has the responsible from in Turkey, and they found me. And that's why I learned the FEMaLe project around maybe 8 or 10 months ago. I would like to learn from my friends or from the Aarhus University or Axel Forman and something like that, but it doesn't matter. That's why it's very important for me to be involved in this project, because this is our aim. That's why we are dealing with these patients and we are dealing with the research and something like that, to put another brick in the wall. Actually, we just helped you a few months ago for the questionnaire. Did you know that one? I don't exactly remember of the name of the woman, and he sent me the questionnaire for the diagnosis for the patients and for the doctors, and the questionnaire. It continues maybe 3 or 4 months, and for the translation of the questionnaire to the Turkish. After that, we choose some of my patients, and they answered a few times to questionnaire, and one of my fellows, and I don't remember, but 5 or 6 the doctor, or around 10 patients, like something like that. I am not exact. I remember exact number. We started like this, and we just finished that project. That's a small project, but we did it. If we involve this project correctly, I mean as a full involved, that means we can do it this kind of projects as a part of this project, or the separate one in my country. It's important because we have the 80 million in Turkey. That's why approximately we have 2.5 million endometriosis in this country. If we assume the 10%, that means huge number. And we involve and we affect. We are most of our neighbor has an influence to Turkey. That's why the Turkey is maybe you know or not, really good health system.
Okay.
That's why they say I mean the Middle East and the other neighbors in my countries, they will say yes, maybe we can involve this project. We can do this project like Turkey in our country, in their country. It's important. That's why I believe FEMaLe project has a really good motivation for us. I mean, not just for you, in my patients, in my country, in my fellows. That's important. Gender equality, this is the woman's disease, actually, not the man disease. I didn't understand very well. If you are highlight the LGBT patients, I mean, maybe it's something like that. I understand. Did you understand?
Yeah, I'm familiar with it. Yes.
That means it's normal. It is natural. That there is no problem with us, with me or with us, with my team. That's why we can do everything for the human. It doesn't matter male, female, transgender, something like that. This is not our problem. We have to help all the patients who needs the help. That's our aim. That's why we can answer this one. Yes, we believe, but I don't know how can we deal with this one. That's the problem. But the lesbian and gay patients, they have this disease because gay patients has to use the estrogen or the hormonal, and the lesbian patients maybe have this disease. That's not our problem. We have to help them, irrespective of the gender or irrespective of the religious and the political situation. This is not our problem. This is the really good question. Let me answer it. As I told you, my story, I start from the bedside to the bedside. You are asking this one. I was at Yale days, at 3 years, at the laboratory. I saw the really research in that time. It was in that time, if you according to that time research, it was really good because I was at Yale. This is one of the most important in university and the department in the world. And I saw the peritoneal fluid, I saw the cell culture, I saw the beginning of the genetic, I saw the blood analysis, something like that. And now I have a lot of patients from the Europe, not just my country. That means the problem, most of the people knows the bank side, but they didn't even know information about the clinical side. The other problem, most of the people know the clinical problem, but they didn't even know what is the research, what is the background. You need, like me, not like me, knows the bedside to the bedside. She or he has to know the both of sides. After that, you can translate the research in this way to the clinical way. That's the problem. We have no new drug last 20 years. This is unbelievable. Because of this problem, only we have the new drug for endometriosis, GnRH antagonist 2 years ago. From the 1990 to now, there was no new drug. A lot of investigation, a lot of phase 1, phase 2 trial, supported by the big companies like Bayer and other ones, but no answer. Because they are the lab people, they don't know the real importance of the disease in clinical practice. That's the main problem. And that's why we need, let me say, Oxford group, Krina knows the bedside, Christian Becker knows the clinical side. I mean, like the Edinburgh group, Philippa and the Horn. Did you understand? It has to be one brain to think about the both of sides. It's important. That's why maybe FEMaLe project or like this project give another way to think just one way. I mean the two-way research and the clinical, but it has to be in the one way to translation. Did you understand what I mean? After that, we can find new methods to diagnose and treat. That's why for the using the AI, I mean the artificial intelligence, after that, maybe we can do it. How can we diagnose earlier? I mean research, I mean the surgery for it, I mean the surgery or the non-invasive diagnosis. And for the therapy, you need, I wrote your research, your FEMaLe project, I mean the horizon, something like that in the website. And maybe you need put the more translation, I mean the more research to the project to get to the more practical algorithm for the future. Did you understand what I mean? And most of the projects related research, most of them clinical, not the correlation between them. Actually, if you do our main goals that we mentioned before, the awareness, early diagnosis, maybe a little bit therapy, beginning of the diagnosis to the long-term situation, it means we have the successful. The main important thing, as I told you before, non-invasive diagnosis. This is the really important, important than everything. If you or together or someone can do it, that means the main breakthrough for this disease. That's why non-invasive diagnosis is very important. This is the our main goal. Main game, I mean the every event has the two sides. That means win-win. The FEMaLe project has to win, and in our side has to win. What does it mean? As I told you a few minutes ago, I established the Turkish society, which is really hardworking, one of the hardworking society in the world. They know, and like the UK, like the Ireland, like the Canadian, like the Australian, we have the connection with them. That's why we have to gain from our side with the FEMaLe project to increase the awareness and to do some other things. Maybe we have to need some budget. I don't know. It's possible. For the we have the school projects. I mean, we say endo at the school, and but we need more motivation for this one. As I told you, we have 40 million women, and around 25 million is the reproductive age, which is huge number. I mean, between age 15 to age 49, huge number. That's why in general means he has the support with the Turkish Endometriosis Adenomyosis Society. That's important. We would like to involve not just Engin. We would like to involve this project with the society. That's important. That's power for you. And one man cannot do anything. We need the team. I believe this one. That's why it's very important. And gain means from our side, maybe we can get some help from the FEMaLe project. It's important. And we have to put all the data in our data to the project. It's important. I mean, the huge number of the patients. You cannot imagine, believe me, huge number of the patients, because we are working hardly. If you follow I will send you today our website, English and Turkish, and our bulletin, you will see this one. That's why you will follow you will say, yes, they are working. It's very important. And maybe you know the Deborah Bush. You know Deborah Bush from Australia? Have you heard?
I've heard of it. Yes, I have heard of her. Yes.
He is really a hardworking woman. He told me 1 year ago, why you are working so much about this project? Did you do nothing except the endometriosis? I said, no, endometriosis is my 15-20% of my life. Deborah is really good woman, really hardworking woman. We are working on this. We can put all the data from the Turkish patients to the FEMaLe projects, like the Hungarian, like the England. And from my perspective, the unmet need means the other problem, doctors, they have no good knowledge about the disease. That's the other problem. Even in my country, or most of the part of the Europe, and I don't say the Africa. I will have to. I will give a lecture 2 days later to the African conference, something like that. They need really. They have a lot of unmet needs in Africa, and Uh, I am looking for I am looking the FEMaLe project, not just whole Europe. I mean the world project, in my view, not just for the whole Europe. The data may be obtained from the Europe, but we can use this data for the whole tragedy, not just for the Europe, in my belief. That's why most of the part of the world, the doctors needs the education, more seminars, more hands-on workshop, and not just for the patient, not the awareness. We need the scientific awareness, I mean, for the doctors. That's why FEMaLe project maybe has to do some kind of just the conference or 1 or 2 days courses, just the FEMaLe project. Like this, just 1 or 2 days, and to discuss this project and to increase the awareness of the not the patients only, with the doctors, with the healthcare personnel, maybe nurses, maybe other ones. That's very, very important. They have to know this disease. They have to know the importance of this disease. That's why unmet need. Non-invasive diagnosis, more awareness, either patient or the doctors, healthcare personnel, not doctors, healthcare personnel. And this is the important, more awareness from the patient side, from the science side, and the other one, non-invasive diagnosis. That's the main important thing. I mean, the biggest one. The problem is this is the really confusing and the long story, but it's a simple way. For the women's health, and Australia and New Zealand, they are so successful. And recently, French government decided to have to endometriosis patients. Maybe you follow this one. And a few years ago, and New York and the district of the government, just the New York, decided to support this project. But unfortunately, there is no big gain from this one so far, as I know. But we have the model, for the role model, Australian and New Zealand society. They are doing this one very, very perfect, really perfect. Please read these societies. You can follow from the website. They are really good. Not in England, not in Canada, not in the US, not the other ones. Japan has the good healthcare project about this disease, but the problem is the language. Most of the language is the Japan. That's the main problem, but they have good healthcare. If politicians, not just for endometriosis, women's health, we need the different how can I say, like the mayor, just wait for the correct definition. Minister, like this, for the women's health. Believe me, it is very, very important for the society. That's why we need to maybe like minister just dealing with the women's health project, endometriosis, polycystic ovarian disease, menopause, amenorrhea, and the sexuality, and the infection, and the contraception. These are unmet needs for all the countries. Is acceptable, not just for my country, not other countries, even in high level, even in low level. Every level country has the different problems, but the same problems. But the degree of the problem is changing. That's it. That's why if I'm a politician, really, I would like to establish new ministry, something for women's health, just for this one, to get the more public fund. Most of the people now involved the public fund public fund for the cancer, for the demands, and for the Alzheimer, something like that. Not for the woman's health. Maybe a little bit gender problem. I don't know exactly, but for the women's project, unfortunately, the research project amount is low and the awareness is very low. This is destiny now. Maybe in the future with the good examples, not just for the on the table, just write it, I will do it, I will do it. No, you will do it in a realistic manner. That's the important problem.